Hi, my name is Aaliyah and welcome to our presentation discussing the Australian healthcare landscape. We will dive into the intricacies of the Australian healthcare system, a crucial aspect of establishing a successful satellite campus for Johns Hopkins, the Sydney University. As your team of consultants from Australia's healthcare horizon, including Shalika, Ben, Ting, Justin, Sonia, Veronica, and myself, our goal is to provide you with a comprehensive understanding of the system, its strengths, weaknesses, potential challenges, and recommendations to expand with the utmost success. But before we dive deeper into the healthcare system, let's take a moment to envision the future of higher education at Sydney. We hope you have enjoyed the vision of your future campus. To dive deeper into the intricacies of this expansion, we will go through an overview of our capabilities and understanding of your needs, methods to gain a firm understanding of healthcare in Australia, analysis of the health cost, quality, and access, assessment of funding and market, the SWOT analysis, challenges, recommendations, and your invoice. So let's get started by sharing who we are and our capabilities. To ensure a seamless transition for your Sydney campus, our team offers a comprehensive approach that combines deep industry knowledge, functional expertise, and a data-driven methodology. We have a deep understanding of healthcare systems, higher education, and of the Australian market that will enable us to identify potential challenges and opportunities, ensuring a smooth transition for your campus. We are a team of experts in legal and regulatory compliance, human resources, and healthcare strategy, which will ensure adherence to local regulations, optimize campus operations, and mitigate potential risk. We will utilize a rigorous data-driven approach, leveraging quantitative and qualitative methods to inform our recommendations and ensure the development of effective strategies. Our team's adaptness in conducting in-depth research, comprehensive market analysis, and adapting to evolving circumstances will guarantee timely delivery and successful project outcomes. We want you to know that we are committed to understanding your unique needs and tailoring our approach to achieve your goals, prioritizing your satisfaction and success. Our team's proven track record of delivering successful projects and providing strategic insights will contribute to the long-term success of your Sydney campus. With that, we are delighted to take on this project and believe that our team will provide you with the best for your campus expansion. We will now go over an overview of the project scope. So the primary objective of this project is to provide a comprehensive analysis of the Australian healthcare system and its implications for Johns Hopkins University's proposed Sydney campus. By understanding the unique aspects of the Australian healthcare landscape, we can aim to identify potential challenges and opportunities, develop effective strategies to mitigate the risk, and ensure the well-being of the university's faculty, staff, and students. However, there are some potential challenges with that, which include aligning with the Australian healthcare standards. This could result in regulatory hurdles, operational inefficiencies, and potential legal issues, delaying the campus's establishment or compromising its operations. Secondly, in addition, navigating the complex healthcare landscape. Misunderstanding the intricacies of the public and private healthcare systems, including Medicare and private health insurance, could lead to suboptimal healthcare coverage for students, faculty, and staff, which can potentially impact the recruitment and our retention efforts. Next, another challenge is the cultural nuances and language barriers. So those ineffective communications with healthcare providers and patients due to cultural differences and language barriers could hinder the access to quality care, negatively impacting the well-being of the campus community. Compliance with regulatory requirements is another challenge. The non-compliance with complex immigration, tax, and healthcare regulations could result in significant penalties, operational disruptions, and reputational damage to the university. Lastly, formulating strategic partnerships can also be a challenge. Difficulty in establishing those strong partnerships with local healthcare providers, insurers, and government agencies could limit access to quality healthcare services and increase costs. So, by proactively addressing those challenges, we can minimize the potential risk and ensure the long-term success of Sydney campus. So we aim that by the end of this presentation, you'll have a clear picture of the structure of the Australian healthcare system, key issues and concerns, and the implications for faculty, staff, and students. And lastly, strategies to mitigate potential risk and ensure optimal healthcare access. So let's go over some methods to overcome the goals of this presentation. To gain valuable insights, our consultant team took on a multifaceted research approach. We conducted 2 nationwide surveys with a total of 6,124 Australians to gather their experiences with the healthcare system. This survey focused on accessibility, affordability, and their overall satisfaction. We then conducted an expert interview with Dr. Carlos Vega, a seasoned GP with 16 years of experience in the Australian healthcare system. He provided invaluable expert insights into the system's complexities, challenges, and potential solutions. We then took a look at some literature, the latest data and research from reputable sources such as BUPA Australia and the Australian Healthcare and Hospital Association. This allowed us to identify emerging trends and key issues within the healthcare sector. So by combining these research methods, we were able to present a well-rounded and informative analysis of the Australian healthcare system. So let's first start by exploring insights from BUPA before we get into Shalika's take on the findings from all of this research.
Do you ever wonder how private health insurance works? If you need it, what's the value of having it? To answer these questions, let's take a look at Australia's healthcare system and how private health insurance fits in. Compared with other countries, our healthcare is consistently found to be among the best in the world because it's high quality, affordable, and accessible to everyone. At the top of the list is the universal nature of Medicare, meaning everyone eligible for Medicare can get the same essential medical care because it's paid for through our taxes. We all pay a Medicare levy, a percentage of our taxable income that helps fund our Medicare system. But there is also something called the Medicare levy surcharge. This is an additional tax that applies to higher income earners if they don't take out a hospital policy. Medicare then supports the private health system while also using the money to pay for lots of things in our public health system, like emergency hospital treatment, essential surgeries, and essential medicines. The government also subsidises seeing your GP in part or full. So why pay for private health insurance? There are many reasons individuals and families make this choice, and you can ask any one of the 13.7 million people who currently hold either a hospital or extras health insurance policy. Most people who take a hospital policy do so because public waiting lists for elective surgeries can be very long. Private health insurance gives you access to private hospitals, so no public system waiting lists. You can choose your own specialist or surgeon, have more choice in the hospital you go to, more chance you'll enjoy a private room, or in certain cases, have treatments like chemotherapy at home. Private health insurance gives you more choice and control.
Australia is considered to have one of the world's best health systems. It has the 4th highest life expectancy amongst OECD countries, with an age of 81.2 years in males and 85.3 years in females. This is an increase of around 40% since the start of the 20th century due to improved social conditions, advances in medical technology, and health promotion and protection activities. Over the last century, there have been substantial decreases in child and infant mortality rates, contributing to increases in overall life expectancy. Australia benefits from a relatively low prevalence of major infectious diseases due to its strong public health infrastructure. In terms of chronic diseases, cardiovascular disease, cancer, and diabetes are the leading causes of morbidity and mortality. The leading causes of death in 2022 were coronary heart disease, dementia, COVID-19, cerebrovascular disease, and lung cancer. Dementia was one of the leading causes of disease burden in 2023, with the number of Australians with dementia projected to more than double by 2058. In addition, mental health conditions are prevalent. In 2020 to 2022, 46% of females aged 16 to 24 had a mental illness in the last 12 months. Suicide rates remain a concern, particularly among men and Indigenous populations. In 2023, the 5 leading disease groups that caused the most burden overall were mostly chronic conditions. They were cancer, which is decreasing, mental health and substance abuse, which is increasing, musculoskeletal and cardiovascular, which are decreasing, and neurological, which are increasing. Australia has seen great improvement in terms of coronary heart disease and cancer. The coronary heart disease death rate has been falling since the late 1960s and has fallen by more than 80% since 1980. 7 to 10, which is 71%, people survived at least 5 years after a cancer diagnosis during 2015 to 2019. Cancer death rates have decreased by 32% over the last 30 years. While Australia has made great strides in some areas, others remain a concern. Australia has one of the highest obesity rates amongst OECD countries, with a greater proportion of adults who are obese or overweight. 3 in 10 people aged 14 and over consumed alcohol in ways that put their health at risk in 2022 to 2023. And while rates of daily tobacco smoking continue to decline, the proportion of people using e-cigarettes has increased. Additionally, there are health gaps. There's an estimated 35% of a health gap between First Nations and non-Indigenous Australians due to differences in social determinants of health, like education and employment, and 30% due to differences in health risk factors. Additionally, there is a health gap with Indigenous populations. Indigenous populations experience significantly poorer health outcomes, including higher rates of chronic disease, reduced life expectancy from about 8 years shorter than non-Indigenous Australians, and higher infant mortality rates. In 2021, Australia had the 15th highest health spending as a proportion of gross domestic product out of 38 OECD countries. In 2021 to 2022, Australia spent an estimated $241.3 billion on health goods and services, an average of $9,365 per person. The Australian and state and territory governments contributed the majority of health spending in 2021 to 2022. The government covers approximately 67% of total healthcare expenditure through the Medicare system. Most health services are funded by the Australian or state and territory governments. Most health services are provided by privately owned businesses such as surgeries, specialty clinics, pharmacies, dental clinics, and private hospitals. Finally, to discuss Australia's system in terms of affordability for patients, providers, and system efficiency, Medicare provides free or subsidized access to many essential services for patients. However, out-of-pocket costs can be significant for dental care, specialists, and allied health services not fully covered by Medicare. Healthcare providers face rising costs associated with advanced technologies and aging populations. Australia's healthcare system is considered efficient. Challenges are the high cost of some pharmaceuticals and the inefficiencies of a dual public-private model that can lead to fragmentation of care. Australia's health system is often considered relatively high-performing when compared with other countries. Based on the World Health Organization's ranking of health systems around the world, Australia ranks 2nd on the disability-adjusted life expectancy, 17th on distribution, 12th on overall goal attainment, 4th on health expenditure per capita, and 32nd on overall health system performance. To overall assess Australia's quality, we look at patient outcomes. There are favorable outcomes for many common health conditions, including high cancer survival rates and low mortality from preventable diseases. Technology, there's advanced medical technology and widespread electronic health records, which contribute to efficient and accurate care. In terms of infrastructure, public hospitals are well equipped. Rural areas still face challenges with facilities and workforce shortages. In terms of professional standards, Australian healthcare professionals are highly trained with mandatory registration and continuing professional development programs ensuring high standards. In terms of challenges, there are long wait times for elective surgeries in public hospitals, and there are disparities in outcomes between urban and rural or indigenous populations. Now access. In recent years, the Australian health system has been tested. The number of hospitalizations was higher in 2022 to 2023 at 12.1 million. Fewer people are seen on time in the emergency department, and elective surgeries are not back to pre-pandemic levels. On the positive note, telehealth is here to stay. The use of hospitals and other Medicare subsidized services differs by levels of disadvantage. Medicare provides a range of health and hospital services at reduced or no cost to people. For example, costs are fully covered for a public patient in a public hospital. A wide range of medical services are subsidized under Medicare through the Medicare benefit schedule. Generally, the greater the disadvantage, the more likely people are to use public hospitals and GPs and to pay a lower out-of-pocket while visiting the GP or using other Medicare subsidized services. To summarize access, accessibility to healthcare in Australia is generally high, though disparities persist. Medicare ensures universal access to many healthcare services. Gaps exist, particularly for dental care and mental health. People in rural and remote areas face significant barriers to healthcare, including fewer healthcare providers, longer travel distances, and limited specialist services. In terms of equity, indigenous populations and low-income groups experience greater difficulties accessing care due to cost, geographic isolation, and systemic barriers. And the barriers are language, cultural differences, and socioeconomic factors which hinder access for migrants, refugees, and Indigenous Australians.
Hi, I'm Justin Mitchell, and I'm going to speak with you about Australia's healthcare funding structure. Medicare is a publicly funded universal healthcare system in Australia. This system seeks to provide free or subsidized healthcare services to all citizens. It covers hospital treatments, medical consultations, and essential procedures. This arrangement is crucial for Australia's healthcare system since it facilitates the realization of primary healthcare needs. Australia funds Medicare primarily through taxation. In particular, the government imposes a 2% Medicare levy on taxable income. However, higher earners without private health insurance pay a Medicare levy surcharge. This expense comprises an additional tax penalty imposed to minimize the reliance on the public healthcare system. A balanced partnership between the public and private sectors characterizes Australia's healthcare funding system. The government contributes about 67% of healthcare finances. Inversely, the private sector, including private insurance and out-of-pocket payments, accounting for about 33%. This dual funding model supports an integrated healthcare system. Private insurance supplements public healthcare by covering additional services. For example, the former pays for dental care, private hospital stays, and elective procedures. This integration offers individuals numerous choices and reduces pressure on the public system. Integration is crucial because it encourages broader access to healthcare services. The government provides substantial subsidies through bulk billing. The latter allows patients to access medical services at no cost. Similarly, federal and state governments jointly fund public hospitals and health initiatives to maintain system efficiency. On this slide, we will explore how employer contributions impact funding healthcare in Australia. Employers are not mandated to pay directly for employees' private health insurance. Instead, they may offer it as an added benefit. This approach serves as a valuable incentive for attracting and retaining staff. The contribution reduces employees' out-of-pocket expenses, thereby enhancing overall job satisfaction. Employers indirectly fund healthcare through state and territory payrolls. The amount is calculated as a percentage of total wages. These taxes contribute to the public healthcare system and support the health infrastructure. The cash collected varies depending on the worker's wages and the state or territory where the businesses operate. Employers withhold income tax through various levies. The Medicare levy is an excellent example, set at 2% of taxable income. The deduction is taken from employees' wages and paid directly to the government. The cash helps to fund the universal healthcare system. Employers cover medical expenses for injuries sustained on the job. This approach entails compensation for medical expenses and lost wages during recovery. Moreover, the payment promotes a safer workplace by incentivizing risk reduction measures to prevent further incidents. Some companies invest in workplace health programs to reduce healthcare costs and boost employee well-being. These programs can include wellness initiatives, mental health support, and preventative care. The resulting resources are valuable for improved productivity and reduce absenteeism in businesses.
Hi, my name is Ben, and I will be talking about the market opportunities for opening up a campus in Australia. So, as far as political stability goes, Australia's status as one of the world's oldest and most stable democracies makes it an ideal location for a new university campus. The peaceful and secure political environment provides a solid foundation for international institutions to establish themselves and operate without any disruptions. This is pretty much ideal for what we're looking for establishing our university. As far as economic growth in Australia goes, with foreign investment in Australia growing from $3 trillion in 2017 to $4.7 trillion in 2023, the country's robust economy creates a favorable environment for our educational institution, and the strong economy offers financial stability, so this will help attract both international students and future investment to support the university's growth as we continue through the years. Healthcare demand. Australia has a very large aging population with over 4.2 million people aged 65 or older, and this presents unique opportunities for our university to collaborate in sectors like healthcare innovation, research, and senior care. A campus in Australia would enable us to be at the forefront of addressing healthcare challenges while also providing our students with practical real-world application of their studies. One example of this is like the Support at Home program, which the Australian government enacted to help 1.4 million Australians by 2035. And this aligns with the growing demand for educational programs in healthcare and social services as well. A new campus could contribute to this initiative by offering specialized programs that train our students to meet the needs of the aging population while simultaneously preparing graduates to work within Australia's evolving healthcare system. So I wanted to cover a few additional market considerations, the first being the geographic remoteness of Australia in comparison to the United States. But while Australia's geographic remoteness may increase the cost of shipping materials and equipment, establishing a campus locally would help reduce these challenges. With over 500,000 international students already enrolled in Australia out of the 1.6 million total students, as we see in this chart below, enrollment is less of a concern than anticipated, and our university can help tap into this growing international student market and ensure accessibility to resources while minimizing these logistical issues. The other thing I wanted to talk about was the drop in authorship seen in Australia. So Australia's recent decline in authorship within high-quality natural and health science journals presents a unique opportunity for our university. By establishing a presence in Australia, we can reinvigorate these research output and elevate the country's standing in global academic publishing. Our campus could help provide fresh perspectives, cutting-edge research facilities, and opportunities for collaborative projects, all in turn helping Australia regain its position as a leader in these critical fields.
Thanks, Ben, for discussing the market opportunities and the consolidation. We now move to the SWOT analysis to discuss the findings for Australian healthcare system. Some of the strengths is that Australia has a high quality universal healthcare system providing equitable access to healthcare services compared to other countries under the Organization for Economic Cooperation and Development. Australia also has a well-established digital healthcare framework as they focus on initiatives such as the My Health Record. Australia also has a world-class medical research and innovations in areas like cancer research and genomics, which competing with research-heavy OECD nations like the USA and Germany. On the other hand, Australia does have some weaknesses. Australia's healthcare workforce is disproportionately concentrated in urban areas, similar to issues in other OECD nations like Canada. There are relatively high out-of-pocket costs and a lagging for mental health services. So despite the progress, mental health services in Australia fall short compared to OECD countries like in Finland and Norway. There are some opportunities that can help bridge the gap of the weaknesses seen in the SWOT analysis, and that starts with telehealth expansion, which can expand access to healthcare services, especially for those in rural and remote areas. It can also improve efficiency and reduce travel costs. That can also save patients time and money, and eliminate the potential for overuse of healthcare services. Next, we have health data utilization. This can help with improved decision making. This can lead to better targeted interventions and more effective resource allocation. They can also enhance patient care to help identify and address issues, address individual patient needs more efficiency, and the risk of privacy concerns. Next, we have public and private partnerships. They can attract private sector investments in healthcare infrastructure and services. This can enhance efficiencies to bring in private sector expertise and efficiency to the delivery of healthcare system. And there's also the potential for reduced accountability. They can create challenges for monitoring and ensuring accountability for the delivery of healthcare services. Next, we have some of the threats. One being an aging population pressure. The demand for healthcare services, particularly aged care and chronic disease management, will increase. This could lead to longer wait times and increased strain on existing resources. As a result of maybe shortage of healthcare professionals, increased healthcare costs. Next, we have cybersecurity risk in digital health. These can lead to theft of sensitive patient data, potentially exposing individuals to identity theft and financial fraud. We also have that cyber attacks can disrupt critical healthcare services such as electronic health records and hospital systems, leading to delay in care and potential harm to patients. This can also end up leading to a loss of public trust. As a result of data breaches and cyber attacks, this can erode public trust in digital health systems, making people hesitant to adopt new technologies and share their health information. The last threat is economic volatility impacting healthcare spending. Economic downturns can lead to reduced government spending for healthcare, impacting the availability and quality of services. The economic uncertainty can lead to delays or cancellations of essential healthcare infrastructure projects and initiatives. Lastly, there is the increased financial burden on individuals. Economic hardship can make it difficult for individuals to afford healthcare costs, leading to delayed or foregone care. With this SWOT analysis, we will carry it over to Veronica, who will go more in depth on some key challenges and recommendations.
Veronica Cattell, and I'm here to talk to you about Australia's healthcare system challenges. So, as you know, healthcare in Australia basically is renowned for its universal coverage and high standards, but it faces several challenges that need strategic attention. One significant challenge is the market limitation due to the country's relatively small population and vast geographical size, which leads to fragmented healthcare delivery. This fragmentation makes it difficult to provide consistent and comprehensive care across all regions, particularly in remote and rural areas where access to healthcare services can be limited. The economy is heavily reliant on commodities, also poses a big risk. Fluctuations in global commodity prices can impact the funding available for healthcare, making the system vulnerable to economic downturns. Additionally, stringent drug reimbursements policies can limit access to new and innovative treatments, affecting the quality of care for patients. These policies, while aimed at controlling costs, can sometimes delay the introduction of cutting-edge therapies that could significantly benefit the patient. Potential aggressive cost containment measures by the government to manage rising public sector healthcare costs could also further strain the system. However, while necessary, these measures must be balanced to avoid compromising the quality of care. The strong emphasis on digital health innovation, while beneficial, also increases the risk of cybersecurity incidents, which could also jeopardize patient data and healthcare operations. Moreover, a weak Australian dollar makes imported healthcare products more expensive, adding to the financial burden on the healthcare system. Thank you. To address these challenges, several recommendations can be made. Expanding telehealth services can help overcome geographical barriers and reach remote populations, ensuring more equitable access to the healthcare. Implementing population health management strategies focused on preventative care can improve overall health outcomes and reduce long-term costs. These strategies can include regular healthcare screenings, vaccination programs, and public health campaigns aimed at promoting healthy lifestyles. Economic diversification is crucial to reduce reliance on commodities. Investing in other sectors, including healthcare innovation and technology, can provide more stable funding sources. Engaging with policymakers to advocate for balanced drug reimbursement policies is essential to ensure access to innovative treatments while managing costs effectively. This advocacy can involve highlighting the long-term benefits of new treatments and the potential cost savings from improved health outcomes. Efficient resource allocation and cost-effective measures should be implemented to manage healthcare costs without compromising quality. Strengthening cybersecurity infrastructure is vital to protect digital health nowadays and patient data. Encouraging local production of healthcare products can mitigate the impact of currency fluctuations, while forming strategic partnerships with international suppliers can help negotiate better pricing and terms. By addressing these challenges with targeted strategies, Australia can continue to provide high quality healthcare and improve health outcomes for its population. Thank you.
On this slide, we present the detailed invoice for the consulting services provided by our team. The invoice highlights all services delivered throughout this project. The key elements to this invoice include the description of each service, hours worked, and the respective rates per hour. A total travel expense amount of $8,700 covering flights, lodging, and transportation for the team. The total cost of services rendered is $25,825, reflecting the combined efforts of our consulting team to provide actionable insights and recommendations for the university's expansion into Australia. At the bottom, we've included our payment details for your convenience. Please feel free to reach out with any questions about the invoice or payment process. Thank you.